Welcome to today's session on Unexplained Infertility by Apollo Fertility. To speak on the topic, we would like to welcome Dr. Nikita Lal Patel, who's our in-house consultant. She has done her MBBS, DGO, FCPS, FRM, MRM. We welcome you, Doctor. You can now take over the session. Thank you.
Thank you and good afternoon, everyone. I'm Dr. Nikita. I head the IVF Apollo Fertility at Navi Mumbai. Today, I'm going to talk to you all on what is unexplained infertility and what are the causes. So, what is unexplained infertility? When you know you've tried having relation, unprotected sex for about a year and you've not conceived, and all the fertility tests have been done by your fertility specialist, like the tubes are open in the female, her eggs are growing, the eggs are rupturing, husband semen count is perfect, her AMH report is perfect, there is no thyroid, prolactin levels are good. When she says everything is fine and yet you have not conceived, that's the time we call it the unexplained infertility. That means there is no reason why you're not getting pregnant even after doing all the tests. So in these cases, what might be the cause? As patients come to us and saying, I can't just say that you are a part of unexplained infertility. They want to know the cause. Why am I not getting pregnant? So in those, when the egg quality is bad, sometimes you see, we stimulate the female, get the eggs, but the egg quality, when it's not good, we cannot do anything. When we retrieve the eggs, you come to know. So in an IUI cycle, you do not know the quality of the oocyte. So what is IUI? Wherein you tried having natural relation, you've not conceived, then we go to the next step called intrauterine insemination of the sperms. We take the sperms, wash, the good sperms are left inside the uterine cavity. Okay, if that doesn't help and we do not know the reason, like I said, the egg has ruptured, I've seen on the sono, but we do not come to know whether the egg has been held by the tube. We'll only come to know, yes, the egg has been ruptured. So that is another thing, that we need to know whether the egg has been taken by the tube. If that has not happened, one, you do not conceive. Secondly, what was the oocyte quality when the egg ruptured? That also you only come to know when you go through an IVF cycle. In an IVF cycle, the difference between an IUI and IVF is, in an IVF, I stimulate the female. Maybe in IUI too, we stimulate for a few days. And when we retrieve the eggs, we check every egg, that how many, is it an M2, that is whether it's a mature oocyte, what is the quality of the eggs. And then we take the husband's sperm. If his count is good, we can go ahead with IVF, or we do an ICSI. ICSI is done when the count is very low, wherein we take one sperm and inject into the egg. That will create the embryo. So we have a better answer about the quality of the oocyte, quality of the embryos. So sometimes in PCOS patients, when we stimulate them, and when we get, naturally they've not conceived. In PCOS, I even stimulate, grow the eggs, make sure they rupture, but still when they don't conceive, and when we go ahead for IVF, we realize that the quality of the oocyte in these patients are really bad. What happens in these patients is, when I stimulate, get the eggs, out of 20-25 eggs, sometimes we get out of, after stimulating, sometimes even with a mild stimulation, we get 15 eggs, and only 2 or 3 embryos are formed. Two kind of reason: one is the oocyte can be bad, or the sperm morphology can be bad. So they can be both of the things. So we have to give you an answer to it, and how do we improve the quality for the next time. Sometimes we start PCOS patients on metformin. If the egg reserve is low, we put them on some other medicines to make sure. We change the protocol as per the patient's requirement. So sometimes one cycle of IVF can give you a lot of answers: the quality of the oocytes, quality of the embryos, quality of, sometimes in PCOS, like I said, out of 20, if I get even 2 good embryos, it's enough to get a pregnancy. And sometimes we get some very good quality of embryos and in a PCOS, and they do not implant well. But when we do an IVF cycle, we freeze the embryos. After 2 months, we create the lining again. We make sure the uterus lining is good, and then we transfer. So the implantation rate improves. So these are all the options how we go about for doing the IVF cycle in an unexplained infertility. So remember, an unexplained infertility, and you are young and you want to try naturally, yes, there is no reason that you have to go ahead with an IVF cycle as soon as possible. You can try 3 to 4 IUI. It doesn't work out. Sometimes if you're very young, like 26, 27, I tell people, don't rush into the process. If you're 26 years, you can do an alternate day month. You can go ahead with an 1 month IUI natural, 1 month IUI natural. If you have the age, if the reports are fine, that's the way. And if you are about 30-35, try 3 cycles of IUI. Doesn't help out, just go ahead with an IVF and plan your pregnancy. So, like I said, we have to figure out oocyte, embryo, sperm, what is the reason, and plan the treatment accordingly, give you the exact management, medicines, whatever required, and get you pregnant. So, unexplained infertility is not very tough to get pregnant. We have seen an unexplained infertility even with everything fine. Like, she's not a PCOS, she has a normal egg reserve. Semen count is good. We go ahead for an IVF and they conceive within the first attempt, and we have good embryos frozen for the next cycle. So there is no reason. But in natural cycle, there is some issue, maybe when the egg ruptures, the picking up of the holding of the oocyte by the tube, sometimes that can be a cause. Or late ruptures, there is or the sperms which we wash and leave it inside the uterus. IUI also doesn't help in that. So, like I said, the causes of unexplained infertility would be oocyte, that is the egg, can be the sperm or the endometrium. Like I said, how do we test for the egg quality is only when we do an IVF. I remove the eggs, I test them. Sperms, we do a sperm, more of a testing of the sperms, that is the sperm culture, sperm morphology, sperm antibodies. Sometimes we do a DNA fragmentation test of the sperms. So you do a whole lot of spread out test of the semen count, that will also give us an idea. Thirdly, like I said, the uterus. So if it's not implantation, we do a hysteroscopy. So hysteroscopy is wherein we put a telescope inside the uterus. We check what the uterus lining is, how everything is, and then we transfer once the uterus endometrium is grown well. India, tuberculosis is so common that sometimes we need to test for tuberculosis in the endometrium, and then we transfer the healthy embryos. So these are the 3 ways how we handle the process. And yes, somebody was asking, is infertility hereditary? No. So if you remember, but the thing is, it's not hereditary that you have infertile, so your sister is supposed to be. No, it's like a PCOS can be hereditary, not but infertility. But previously, our parents used to get married by around 20-22 years and finish off their family by 28 to 30. Now the thing is, people are getting married by 28 to 30 and starting the family by 33-35. That is the reason, the most common reason that is causing a lot of infertility. If again we go back to the olden time and start stimulating, getting married earlier and have pregnancies, everything is going to go smoothly. Now, even if people are married by 23, they plan the pregnancy by 33-34. They feel, oh, let me take some time. So when you try to conceive before 28, you have a very high chance. Your fertility rate, fecundity rate is very high. So it's all about the aging and timing. Like we all know, our egg quality deteriorates. Females, we have to make sure you plan your pregnancy at the right time because the egg quality will deteriorate. Male, there is nothing like this. Semen, even at a 55 years, they give their sample, the count. Even if they have 2 million count, 5 million count, you can get pregnancy out of it. So remember, our age really does matter. So at the right time, please plan your pregnancies, that you do not need a fertility doctor's help. If everything is fine, you should conceive at the right time. Yes, stress does affect a lot of fertility. So, like we see a lot of people when they're planning pregnancy, and you see that, suddenly they are having they're having sex as if, the timely, like, I need to have it today. That causes a lot of stress. My egg is going to rupture. They are so much in stress. I keep telling them, you cannot perform in that anxiety. So many men cannot ejaculate, or they cannot deposit the sperms inside the uterus at the right time because of the stress. It's not only the female, even the male. I see so much, when they tell me that, just the day you tell me, on that day I cannot perform, I get performance anxiety, I cannot give the sample on that day. So what do? We freeze the samples, and then we use them whenever, if they cannot give the sample on the IUI date or whatever is the problem, or even they cannot have relation naturally, we use the frozen sample, we thaw it and transfer into the uterus. That also gives you high chances of pregnancy, and the stress in the male is less because they know I have a backup sample kept in the hospital. So if I do not I cannot give the sample today, if I cannot have sex today, they can come to the hospital and do an IUI. So that also decreases the stress in the male, and chances of giving the sperms on that day improves. Being on hormonal oral contraceptive pills for too long, will it lead infertility? See, being on OC pills, oral contraceptive pills for long is not so good anyways. We always say if you take for 6 months, take a break of 2 months. Again, so use change of contraception is very important. It's not that it's bad, but it's always preferable that there are a lot of options. You can talk to your gynecologist about how you can postpone your pregnancy. So one is the oral contraceptive pills. Nowadays, you get very low dose contraceptive pills, which are not going to cause any side effects to you. Or nowadays, there are only progesterone contraceptive pills also, which do not cause weight gain, no side effects. But still, any of these contraceptive pills, I always suggest patients that take it for 6 months, take a break for another 2 3 months, again restart it. So continue that cycle. That will give you a better chance of not having complication or thinning of the endometrium. But remember, even if you were for the longest time on the OC pills, it reverses back very soon. So within 2 months you're again ready to conceive. So it's not a problem if you've taken contraceptive pills for too long, but now at least remember to take a break. So it's always preferable, like I say, take 6 months, take 2 months break, use condoms, or you can think about using diaphragms or some other forms. And then again, start with the OC pills if you're comfortable with that. So would irregular menstrual cycle cause infertility? So remember, like I said, irregular menstrual cycles, that is depends upon how irregular. If you have, some people have a irregular menstrual cycle according to the other people, but they get every 2 monthly, that is regular for them. That's not an irregular cycle. So you have to understand that the test for azoospermia blockage is also a solution. So if it is an irregular menstrual cycle, every 2 monthly you're getting, that is regular for you. So do not take OC pills just to make sure that you also should get monthly. So if it is a 2 monthly for you, that is a regular system for you. So fine, that doesn't, but you have to make sure when is the time your egg ruptures, when does the follicle rupture, and when the follicle is ready to meet the sperm. So that is one thing. You'll have to go through a follicular study, just because, Padma, you do not know when your egg is rupturing because of the irregular menstruation. So a follicular study will help you, guide you, when the follicle ruptures, and that time you have relation, you have a higher chances of conceiving. So there was another question written showing that there was a husband has zero sperm count, azoospermia, and his wife has tubal blockage. So that's a very easy way of management for us, because when the tubes are blocked, we go ahead with an IVF cycle in the female. So what do we do in that? We'll stimulate the wife for 10 days or 11 days with hormone injections starting from day 2 of a period, and within 10 to 11 days we try to retrieve how many eggs possible. So if she's young, we might get many number of eggs. And with the husband, on the same day when I'm retrieving the eggs, I will do something called as an TISA. That is a testicular sperm aspiration. With a small needle, we put it into the testes under local anesthesia. We retrieve the sperms, take the eggs, we take each sperm and inject into the egg and create the embryos. So that will help you conceive, and this is very commonly done in our IVF centers, because we see a lot of males with azoospermia. And azoospermia means zero sperm count. Males with zero sperm count, we have given pregnancy with their own sperms. If the FSH is good, their hormone assays is fine. Even the FSH is a little higher with micro TSA, that is microscopically we go ahead, look into the tubules inside the testes, the healthiest sperm we pick up and inject into the eggs, and we have created, doing an ICSI, we have given results. So remember, if your wife's tubes are blocked, doesn't matter. If her AMH level is good, that is going to give us a high chance of success. So it all depends upon your wife's egg reserve. If her egg reserve is good and you need an if you need an TISA, doesn't matter. Because number of eggs, if I get 15 number of eggs, I do a testicular sperm extraction, I just need 15 sperms. So that will give us a high chance. And yes, you should go ahead, because you're a proper indication for an IVF cycle, that is IVF ICSI, with your tubal blockage and the zero sperm count, and which is going to give you success. Previously, about, if you would have thought about 20 years back, when there was no ICSI, there was nothing, you would have to, 25 years back now, you would have to even go for a donor sperm. But now we have so much of opportunity and the science progress, you can directly go ahead for an IVF ICSI cycle with a TISA, and you're going to have your own pregnancy. So there is, remember, with the science progress, even people who have BOH, that is bad obstetric history, wherein, they have continuous abortions when there is no reason find out, why she's aborting again and again. We can do pre-genetic screening, that is, we create the embryo till a blastocyst level, then we remove a biopsy, remove few cells from the embryo and test it. What is there, any abnormality in the embryo? Is the embryo at fault? What is the problem? And then we transfer the healthiest embryo back into you. So with all these, nowadays the chances of abortions also decrease, but you need to go for a hell lot of tests, lab work, like karyotyping in husband wife, a whole exome sequencing. So they do a whole genome sequencing of husband and wife to find out is there any abnormality in the male and female. And if the female has the same abnormality the male has, then the chances of abortion increases. So these are how we need to figure out, get the things in place, and then we have to plan the pregnancy. But with all this, like I said, unexplained infertility or BOH, bad obstetric history, with low sperm count or even a zero sperm count, everything has a chance. You can give yourself a chance with your own genetic material, that is your eggs and sperms. You will see nowadays even people coming with lots and lots of patients coming with low egg reserve earlier. People are getting menopause very early, so that is very commonly seen now. And what else can we do for that? We have to make sure that we embryo pool. So what we do, one cycle remove 2 3 eggs, again another cycle remove 2 3 eggs, try to pool more number of embryos, and then we have a like a storage of good quality embryos which we can transfer back into you and give you the pregnancy. So we have all the options which we can try to give you the pregnancy. There is in our infertility treatments too expensive. See, infertility treatment are expensive. Why? Not very expensive. It is affordable in every way, because it depends upon the injections. So there are recombinant FSL hormone injection, which are purified, highly purified injections. They cost a little bit more expensive. The lab, because everything what we use has to be thrown off, we cannot reuse, everything is disposable. We have to make sure the embryos are put in the incubator, which is, the incubator is like the womb's temperature. So everything is like your body, everything inside the lab will be as much as your body temperature is. We create the embryos and we leave it inside the incubators, which for 5 days the embryo will grow outside inside the incubator, where the temperature is like the human body's temperature. The day 5 embryo, which is a blastocyst, once you see a beautiful blastocyst, we freeze them and we transfer it back into you. You have a high chances of conceiving with such a beautiful blastocyst. So that's the reason. But IVF is not that expensive. It starts from about 80 90,000, goes up to 2 lakhs, depending upon what is your cause and what you need. And IUI goes to very cheap, about 8 to 10,000. So you should not sit in the house and waste your time. At the right age, you start your treatment planning, you have a higher chance of success. Is IUI IVF better for unexplained infertility? So like I said, in an unexplained infertility, we prefer to go ahead with an IUI cycle. So starting first 3 months, go ahead with an IUI, wherein we will make sure do the IUI, wherein we take the, like I said, what is the difference? Firstly, I would like you to know, both IUI or IVF, day 2 day 3, you come down to the hospital, we scan you, we check whether there are any cysts or anything. If there are no cysts, we start you on stimulation drugs, injections. For IVF, in IUI, instead of the injections, first 5 days we just give tablets, maybe 3 to 4 injections in an IUI. And IVF, we need to give you 10 days of injections. IUI is just similar like relation. So we how he has relation, leaves the sperms inside the vagina. In an IUI, we make sure we wash the sperms and we leave it inside the uterine cavity. Okay, that is the only thing. And in an IVF cycle, what we do, we remove the eggs, we take this eggs out, we take the sperms, we create an embryo, we create an baby, and we freeze them, and then we transfer into you. So if it's an unexplained infertility, you are young, I would suggest you should still go ahead with an IUI cycles, at least 2 to 3. If you're less than 33 34 years, you can try. If your AMH is good, like I said, unexplained means everything is fine, you can try 3 to 4 cycles of IUI. It doesn't work out, then go ahead with an IVF cycle. I wouldn't say rush for an IVF, but yes, mentally you have to have patience. If you've lost your patience and you feel that no, every failure is going to get me depressed, then yes, then go ahead with an IVF and try to get your pregnancy as soon as possible. So it's all upon your mindset, because the treatments, we are ready to tell you everything on the paper. Remember, whatever IUI gives you about 15% chance of pregnancy. So like 10 people of unexplained infertility are doing IUI, about two people will get pregnant, and IVF about 5 to 6 will get pregnant. So you understand the difference between the two. The results are very higher in IVF, because you are, and everything is fine, being the uterus, the ovaries, the semen, everything looks good. That's the reason the chances of conceiving is much higher in an IVF cycle. So it's not like, but like I said, do not rush into anything. Have patience. Try 2 IUIs. Doesn't work out, you can talk to your fertility specialist again if you need a laparoscopy. What we do, sometimes we do 2 IUIs. If it doesn't work out, we put in a hysteroscope, check in the uterus, everything looks good, or just do a lateral scratching and then go for another 2 IUIs. And if in 4 IUIs you've not conceived, then we shift over to an IVF cycle. So that's how you need to go ahead and plan your pregnancy. And remember, with an unexplained infertility, it's more frustrating to both, not only to the doctor, even, as much as the patient is like, everything is fine, why do I need treatment when everything is fine? That's the main question when they come to us, like, my eggs are, everything looks good. You're saying my eggs are fine, the eggs are rupturing, tube is open. Why am I not getting pregnant? Why can't you give the reason? Why do I need to go for an IUI? I totally get it. We know how tough it is for you when we tell you to go ahead with some treatment when everything looks good. But that is what we've seen with a lot of evidence and a lot of research in unexplained infertility. Go for 3 IUIs, it doesn't work. Shift over to an IVF cycle, you will get good pregnancy rate. So it's not, but remember, like I said, if you're 26, 27, you can even wait for 6 months with 3 IUIs with alternate day natural cycles. And then if it doesn't work out, go for an IVF cycle. But with an unexplained, you're sure shot going to get the pregnancy in hand, because everything is good. Sometimes if our first cycle do not work, even in an IVF, a second cycle will surely give you the results. So there's no reason, like in a PCOS, sometimes we talk about the quality of the eggs, azoospermia, oligospermia, quality of these sperms. So when we have some reason to know whether the quality is bad, that's the time we can give you chances go to 30-35%. But here, when everything looks good, you have a good chance, about 50% chances of conceiving with a younger age. So at right time, it's most important to manage your pregnancy. Do not, think that I will think about it later, because what happens, I have so many patients who got married at a right age, I would say at 25, 26, but they come back to us at a 40, just about 38 or 40, saying that now nothing worked, I tried naturally, everything was fine, but I couldn't conceive. Now it's too late for us to help you, because your egg reserve has dropped down. So I always tell people, even everything is fine, you're not conceiving, you're not getting an answer, do not waste your precious time. Age, remember, females, the age is very important. We cannot get back the quality, we cannot get back the good quality oocytes. That's the reason you have to plan your pregnancy at the right age. Sometimes some people have chocolate cyst. Nowadays, very commonly seen, like they call it the endometriosis or chocolate cyst, wherein the patient has severe pain when they have relation, or severe pain when they get menstruation. It's really bad, for first 2 days they are like crying with pain. That's the time when you do a sonography, they say there is something like a chocolate cyst. That is because when you're bleeding, when you get your menstrual bleeding, the bleeding a little bit comes in around the adnexa, that is around the ovary, and the blood accumulates and it looks like a chocolate cyst, and that causes a lot of infertility too. So if you have pain, dysmenorrhea during your menstrual periods, go and meet the gynec. We need to find out what is the cause. The basic thing is, within 1 year of unprotected sex, you do not get pregnant. Rule out everything, rule out from all the basics, from your egg. Like I said, there are just few things which you have to see in a female: is the tube, the eggs, the endometrium, and male is the semen count. That's it in this all. And thyroid and prolactin, we'll come to know where we stand. So sometimes you should not even miss your sugars when you're doing the basic test. Do your sugars too, because sometimes nowadays we see a lot of diabetes and blood pressure even at a younger age. So we should not miss out the basic test when you're doing hi-fi test. You cannot miss out the basic test. Remember, day 2, day 3 also there are some fertility tests like an FSH hormone, which will know the quality of the eggs. So these all tests should be done. First, you should go on a day 2 to the gynec, or day 2 of your period. So they will give you the right number of blood tests to be done, which is done on a second or the third day. They even do an antral follicular count, that is, you come to know how many eggs are seen on the left and the right side. So you have an idea that how long you can wait, how long is the process, everything together, and plan your pregnancy. So there are some reasons. Sometimes there is no reason for infertility. Whatever it is, we need to manage, and you will get pregnant. There is no way that you say that you're not going to get pregnant if you're at the right age. Even people come at a 40 trying for their own eggs. That's the time, like I say, you can go ahead if your AMH and FSH is good, and if your AFC, antral follicular count, is good, wherein you see few eggs, 5 6 eggs, you can stimulate yourself and try to remove the eggs 2 times, embryo pool them, and then transfer it into you. So we have all the options. How do we go about and plan your pregnancy? Is there any other questions, or anyway, is this so fine? So that's all I think you all need to know about unexplained infertility. Like I said, just keep on trying. You're going to conceive when you try naturally. From day 10 of your period to the next 16 days, alternate day relation will help you conceiving. That's the time you should have relation. From day 10, if your periods are regular, from day 10 to the next 16 days, alternate day. And if you do a follicular study to check when the eggs are growing, when you see the follicle size is 16, start having relation till the egg ruptures, and maybe after rupture 1 or 2 days extra. So all this together can help you conceive naturally. I hope it helps you guys, that try naturally, do not give up, always think positive, and have the hope that you will conceive and it will work. All the very best to you all. Thank you.